So today on SHEMD, I am very excited to welcome Danielle, Gronich, and Kayleigh, Christina, the founders of Clearstem. So we're going to talk about acne, aging and acne. I have a little bit of acne and I haven't had it since I was a teenager. So the idea that you created this company with both aging and acne in mind is amazing. And I also love a double whammy female-founded company. I think you can't go wrong with that. But so thank you so much for being here, guys.
Thank you for having us.
Can you just kind of tell me your origin story? How did it come to be the two of you met and started this company?
Yeah, it was meant to be. It was written in the stars. So first things first, acne is genetic, right? So if usually it runs on your family on one side, mom or dad, whatever. I had it on both sides of my family, grade 4 into adulthood. Like my dad's in his 70s and he'll still break out if he uses like the wrong lotion. Same thing on my mom's side. So I never stood a chance. So my acne was awful. It was normal in high school-ish. But then when I got to college is when it erupted. I got put on the NuvaRing, which actually can make acne worse for a lot of people. I started, partying, eating dorm food, wearing makeup, all the stuff. And it just became the perfect storm. So I was in and out of multiple different dermatologists' office, estheticians, like trying everything. And through the course from college to my late 20s, call it from 19 to 29, I actually was on spironolactone for off and on for about 4 years. I did Accutane 3 separate times. It came right back. So fast forward, after trying everything under the sun, all the Retin-A's, all the peels, all the lasers, all of that, and nothing worked. I was like, okay, I'm gonna have to figure this out myself. I happen to have a biology background. I studied cellular biology, immunology, and genetics. So, and I come from like a family of scientists. So I just love learning about the human body. So age of 29, third round of Accutane has failed. And I'm like, all right, I'm gonna have to figure it out myself. So I start looking at like classes about where I can learn about skin. How do I get the knowledge for myself? And the only way to really get it was to enroll in esthetician school at night. I was in the corporate world doing consulting. So I enrolled at night just to get the information and bounce. And then when I got there, I was like, no, treating acne is actually the most beautiful profession ever. It never would have occurred to me to become an esthetician because I was on track to go to medical school, but I had stopped because of all the prescription writing and I just didn't want to do that for a living. So basically, yeah, I became an esthetician, shadowed under a lot of the top people in San Diego so I could be a sponge and learn. And then I started San Diego Acne Clinic about 10 years ago. Kayleigh was one of my first clients ever.
And you were called the Acne Guru?
Literally. So yes. I did not have that is my given name. Yeah,
it's on her license.
It was kind of a nickname, and then it became the nickname that stuck. So we decided to trademark it, and it's the acne
she
guru.
Is the acne guru, though. I met Danielle. This was 10 years ago. I got put on birth control at the age of 14 for acne and mood swings. I had divorced parents where I was in and out of court battles all of the time. So, of course, emotions were high. So I got put on birth control at age 14. And then about a year later, got put on Prozac for having anxiety. And now we know the two are very linked. There's so many women who go on birth control and within the year get put on an anti-anxiety or antidepressant medication. So I was on both of those for about 10 years. When I was 24, at this point through college, I had 2 ovarian cysts that ruptured. So I had 2 trips to the emergency room for that. And I had a benign breast tumor removed that was about the size of a golf ball. So 24 years old, I was becoming really passionate about the effects of what you put in your body and the effects that it has on your body. And so I decided I wanted to cold turkey, be done with birth control, done with Prozac, and not be on any medications. A few months later, my skin completely erupted on both sides of my face, down my neck with bright red cystic acne. I'll show you guys a picture. It was really aggressive. It was boils.
Wow.
I couldn't even pop a lot of these. And I was trying absolutely everything. So I'd gone back to get my certification as an integrative health practitioner. And so I was putting myself through all these different dietary protocols, elimination diets, you name it, low FODMAPs. Nothing was working. I didn't know much about skincare. So honestly, I was Google searching, I was on Pinterest, and I was walking into beauty retail stores asking what I should use. So I was using like DIY things at home where I was like rubbing raw garlic on my face, to using more clinical lines from dermatologists that they had suggested I use it, to walking into the drugstore and buying anything that could help with acne, to walking into, again, like beauty retail stores and showing them my face and asking what could help. So I tried what I felt like was absolutely everything that could have possibly marketed towards acne. When all of that failed, nothing worked. This is about 10 months later, I was like, okay, I guess I have to go to the doctors, because I was trying to avoid going to the doctor because I had just gotten off birth control and Prozac, and I had a feeling that they were going to tell me to get back on birth control. Sure enough, I went to multiple primary care doctors, and it was birth control or antibiotics as my only solutions. And I was like crying in doctors' offices being like, something's wrong with my body. Like, okay, you want me to go back on birth control, but what's actually wrong? And so then I went to dermatologist. I decided to move forward with Accutane because I truly felt like there was no other option. So I started the process. It takes about 30 days to get on it. You have to take the 2 pregnancy tests. Right before I was about to start, because my mom was begging me not to go on it, I had one last Google search, a Pup San Diego acne clinic. And that's when I met Danielle. And that's when my whole world was opened up into what are the actual root causes of acne. I made very simple shifts. I removed skincare products and makeup with pore-clogging ingredients. Mm-hmm. I removed certain foods that are higher dietary triggers like eggs and dairy. And I was over-supplementing so much at this time. This was like the height of biohacking. Mm-hmm. So I was on so many supplements, powders, green powders, protein powder, you name it. Everything. This was when people were putting like 7 different powders in their coffee every morning, like that era. And so I was taking a lot of supplements that were actually like raising my testosterone levels and causing hormonal imbalances. So I removed all of those, and my skin was completely clear in 2 months.
Really?
Under Danielle's guidance.
It breaks my heart.
Yeah. It was, we know how much acne affects people mentally, and the correlation of really aggressively struggling with acne and being on antidepressants and anti-anxiety medication. And so all of our entire Clearstem team has struggled with acne before or some type of skin issue, because we need to make sure every single person on our team is leading with empathy when engaging with our customers every step of the way, from our web developer to our head of customer service to social media, everything, because it's so important to meet the acne consumer with empathy because they've been through so much.
Wow. So tell us what you did. Like, so we heard a little bit. So she walks into your office, she's got the cystic acne. What did you do?
So the first thing we do is we spend about 40 minutes going over your entire lifestyle and everything that you're using. So the full ingredient deck, not just the active ingredients, but the full ingredient deck to every single product. And then I have people either bring in their vitamins or take a picture of the nutrition label. And then we go through all of that, eliminate pore-clogging ingredients and the skincare and makeup. If the 80-20 rule did exist for acne, it would be about pore-clogging ingredients.
But give me an example of that.
Oh, there's about 100 of them. An example is ethyl hexyl palmitate. That's a common ingredient in makeup and some moisturizers. Another one is isopropyl myristate. That's a really common filler agent in hair conditioners and sunscreens and a lot of cream preparations. Other ones that are, quote unquote clean and that wouldn't, sound any alarm bells can be something as innocent as coconut oil. But if it's thicker than our natural oil, it can clog us up. And there's that comedogenic scale. It goes from 0 to 5. Most things are just somewhere in the middle. Like water is a 0. Hyaluronic acid is a 0. Coconut oil is a 5. Ethyl hexyl palmitate is like between a 4 and a 5. So like we really have to remove all the pore cloggers. Otherwise, you'll never get clear. You can have perfect hormones, but if you're still having pore clogging ingredients, you're still going to get clogged and develop new acne. So that's step 1. And we leave no stone unturned. And then we go over the vitamins. There's a few key vitamins that for some women can spike their testosterone. Vitamin B12 is one of them, and it comes in obscenely high amounts. Like a lot of these supplements have like 80,000% RDV. I saw one the other day that had 275,000% RDV. And it can create just massive hormonal acne right where you'd have like kind of a beard or on the jawline. Super common. I see that a lot with the injection. So we go over all of those. Then we go over diet. What are you eating? When are you eating? What are you having for breakfast? What's the first thing you put in your body? What caffeine level? So we just get a snapshot of the person's day-to-day life. And from there, we fine-tune the diet. We do advise for elimination tests. We don't want to create food fear at all, but eggs can be a big trigger for a lot of people. They were a huge trigger for me and they were a huge trigger for Kayleigh. So we say, okay, eliminate those for about 8 weeks. Then you reintroduce them on purpose. Go have a quiche or an omelet or something, right? Like factor it back in and pay attention to what it does to your skin. That way you can know your unique threshold. So at the clinic, that's what we do. And then as far as treatments go, we do some exfoliating treatments. We use a couple different peel solutions, combo with like a microderm. We do really good extractions, get all of it out of there. And then while I'm doing extractions, I look and see what's inside the pore. And if it's from a pore clogging ingredient, it will actually be like an orange ball of wax. It just kind of sits in the pore, hardens and stays there and oxidizes and turns into this like orange color. So it'll match, like what's inside the pore should match what we found during the discovery part. So that's in a nutshell what we do. But we took all that information that I was getting from the clinic and put that into what is now Clearstem.
Amazing. That's amazing. So I want to get into the creation of Clearstem and those ingredients, because you guys are very careful about the ingredients that you use. And one of the things I love about the company is backed by research and science. But as you know, since we're talking about aging and acne, when I was in my 40s, I would slather oil on my face. I mean, I couldn't put enough oil on my face. And now, like as I'm in my 50s, my skin has changed. Like it feels like I can't really put, like all of a sudden it's like, what happens with aging skin? And why does that?
Do you feel like it's now clogging you up or it's not absorbing as well? Like what has shifted?
Yeah, I feel like I'm getting clogged now. I mean, does that happen with aging skin? Does all of a sudden like perimenopause and menopause?
Yep.
Okay, so
women go through a lot of different hormonal, like the roller coaster never ends, right? You know, you got your teenager stuff, then you got when you get put on birth control, then you have when you get off birth control, then when you have pregnancy, breastfeeding, and then perimenopause and the stress of day-to-day life, right? So it can start and stop at any time. That is something that a lot of women, like, you know, you had it when you were in teenager, but then it went away.
Yeah, a little bit of acne. Yeah.
Got it. So a lot of people have it, like they'll have eras in their life where they have it a little bit, but it'll always be a little bit different. Like sometimes it'll be on the forehead when you're a teenager. And then when you, the next time you have it, it'll just show up on your chin and you're like, what is this? Like it kind of moves. So it's definitely tied to different hormonal stages and phases, but then pore clogging ingredients matter all the time. If you're in a scenario where your pores are not getting clogged and your hormones are fine, like say you are on Accutane and your oil glands are being so torched that you're just not going to break out. You can kind of use whatever you want. You might stay that way for a year or two as your oil glands kind of come back to life. And then maybe with the addition of like, say, a supplement that has a lot of zinc in it, for example, because zinc can also raise testosterone, that might be enough to send you back into being acne prone. And then you now have to start carrying what you were using. So some ingredients can work fine for you during certain phases. But if something happens where you become more acne prone, then that same product can start to not work for you. So that is something really common that a lot of women can relate to.
And I know what you're thinking. You're sitting here, so I can read you like a book.
Read me like a book.
How do you know, or how do you, like a lot of this sounds like PCOS, like the way you guys describe everything about your journey and the way that the acne is here, like or does it even matter when you're dealing with skin? If you have, is that what you're going to?
PCOS is a common culprit and it goes so underdiagnosed.
Yes. So I think your clinic would be the place where these patients show up, right?
That is where most of them come. Yes, I feel like everyone we see has PCOS.
But it's true. That's who's showing up to your doors, because 75% of these patients with PCOS or polycystic ovarian syndrome are not being diagnosed, and they get so frustrated, right, with their skin, with their hair loss, with their weight, with their irregular period. Different patients have different symptoms that they finally get, thank God for your clinic, to at least give them, because acne causes a lot of self-esteem issues.
Yes.
And
it's devastating.
It's devastating. And because these patients go dismissed and undiagnosed, they don't know how to deal with it. They don't know what's causing it. But as I'm sitting here and listening to you guys, I'm like, are you sure your patients don't have polycystic ovarian syndrome?
We always tell people to check. We screen for that. We ask how their periods are doing, if they have any other symptoms. Yeah.
So a lot of times, elevated testosterone symptoms, you know, I always say you need 2 out of 3 criteria to diagnose PCOS. 1 is irregular periods. 2 is PCOS looking ovaries on ultrasound, which doesn't mean you have cysts. It means it's a specific look on ultrasound for polycystic ovaries. And the third one is elevated testosterone symptoms or elevated testosterone in the blood. So elevated testosterone symptoms are facial hair, body hair, male pattern hair thinning. Acne could be very, very common. And we see that you can see body acne with these patients, facial acne, usually in the jawline, which is hormonal. You're not getting to the root cause of the problem.
It is such a relief to hear a physician speak to this. It is, people are getting put on Accutane like it is candy, and it can make the root cause worse.
Bravo.
Taking the batteries out of the smoke alarm is not a strategy. Like, it gets worse for so many people, and we see that constantly because we actually have an acne lab panel where we have blood chemists and immunologists like going over people's blood work in a very different lens than they're getting from a conventional, Western medical appointment. And things like, what are we seeing? H. pylori is huge. H. pylori.
We're seeing a lot of underlying infection. A lot of people who've been struggling with an underlying infection for upwards of a decade and having a decade-long acne from underlying infection, mold, heavy metals, because we are in the era of, back to so many powders, protein powders, heavy metals in the water, in the metal jugs everyone drinks their water out of all of the time. And so it's a compounding effect that we see with a lot of people. It's not just one thing, but people's toxic overloads are just getting too high right now. And we're seeing so much of that in the blood work.
I'm all about finding the underlying condition. And, when you tell me sugar triggered it, could it be insulin resistance with PCOS, right? And when you cut sugar out, started exercising, started taking care of your skin, doing everything right, your symptoms improve. But that doesn't always work for every single patient. So that's why I say your clinic is a gateway for these patients who are undiagnosed, dismissed, on the wrong treatments. You can look at someone and 90% of the time, sometimes I ask random people, I'm like, by the way, do you have irregular periods? They're like, how did you know?
Yeah, they feel so seen by you saying that.
Critical question, yeah.
Right?
Because it tells you so much.
And these guys you have a lot of education. I think
much
that's
education.
part of what they do is
this is amazing.
Yeah, it's amazing.
I wish your clinic was next door to my office.
Everyone's like, when are you going to make it? When are you going to expand? And I'm like, we are so detailed. The training my girls go through is insane. It requires a lot because we're so detail obsessed. But that would be phase 2.
But both of your skins are glowing, and from that picture you showed me, it's shocking.
It's shocking that you're able to be where you are. So can we talk about the ingredients? So
the process.
What makes this different? How did you go to formulating your product? Like, was it trial and error? Was it science? How did it happen?
And how many products do you have?
What do we have? How many now?
I think about 18.
Oh, wow.
So, this is one of our fun ones, what we like to call, because it's an acne-safe oil, because so many oils aren't acne-safe.
I'm a slut
So
of that.
Golden Hour,
you're gonna love it.
It's not a part of our core kit that we would put someone on when someone's struggling with acne. It wouldn't be the top 4 products we'd recommend, but it was a product that our community had asked for so long, because our community will get clear and then they love the gua shang, the facial massages, they love all the natural alternatives, and it is near impossible to find an acne-safe oil without pore-clogging ingredients. So this was a long, years and years, our community had asked us for a non-pore-clogging oil that would absorb, that would smell good, that would feel good, that they could put makeup on top of, that they could gua sha with. So this was a really exciting product that we made for our community that's been asking for it.
Can I put on my hand?
Yes.
It feels so good and it smells so good.
I'm really excited.
Thank you for asking the question on ingredients. This is the thing we geek out on all the time. So every product in the Clearstem line is both anti-aging and anti-acne simultaneously. Why that's so important is because normally those 2 things cancel each other out. Anti-acne products are really drying. They're harsh. They destroy your barrier, which makes you get UV damage faster, makes you age faster. So that's not fun. And then you're also peeling. So it's like, okay, you want to tackle your acne. You're also destroying your skin and compromising how you age. Then you go to anti-aging products, and they all have these filler agents that clog our pores. And I'm talking 95% of companies use the same filler agents because they have a long shelf life and they're cheap. So every anti-aging lotion that you generally come across is going to clog your pores and create new acne. Same thing with moisturizers and sunscreens. Those are like the two biggest things that break people out. Everyone with acne understands what it means to be terrified to put sunscreen on. So it's like you're stuck between a rock and a hard place between acne and aging. So we wanted to make sure that people did not have to make that sacrifice anymore. And then basically we put growth factors into all of our formulas to help rebuild the skin as it's helping with the acne. So you will see some of the OTC acne ingredients that we know and love, like sulfur, salicylic acid, but then you'll also see it layered with anti-inflammatory ingredients like arnica, green tea, turmeric. We optimize for joy of use with our products as well, because so many acne products are just stale and stinky, and
it makes you dry and you start peeling.
Yeah, they're just not fun. And everything that was wrong with acne, we fixed it because we're both our customer and we have the ethos to stay one with our customer at all times. So it's like, what would I want to use? And being an esthetician and having my protocol be to evaluate everything that everyone's using every time they come through my door, got to interact with thousands of products. I would feel them all. And I'm like, okay, this one seems nice, but it stinks. Or this one has great ingredients, but it's sticky. So it's just knowing what the ingredients that are helpful and good, and then what's going to actually rebuild the skin, what's going to not cause acne, and then what's going to make people happy. That's how we put Clearstem products together.
Wow. So walk me through, because I get a lot, obviously all I see is PCOS. I have a skewed view on, I think every single person on the planet has.
Now you make me think every single person.
I think most people have some sort of insulin resistance type issue.
Yes.
So I think you're more accurate than inaccurate.
So my question to you is, when I see a PCOS patient with acne, regardless of age, what products would you recommend?
I would have them start with our Clear Kit. For anyone who's listening to this, make sure that you know what the problematic ingredients are. You probably have moisturizer, sunscreen, makeup. Put everything through the pore-clogging ingredients checker that we built on our website. That is step one. Because otherwise you can change things, but if your makeup is still the problem, you're still going to struggle. So identifying the problematic pore cloggers is step one for everyone before you change anything.
Just like I asked everyone this, every time you see a patient that might have polycystic ovarian syndrome, either refer them to a specialist, because it doesn't end at the skin.
Yep.
They have egg quality issues. They can have endometriosis. They can have hair loss, irregular periods, fertility issues. So for that reason, it's important for them to see a specialist, especially because you guys are the gatekeepers. They are coming to you, especially at a younger age when everyone else dismisses them. But also on our site at ov.com, there's a questionnaire they can take, just like yours for acne, and it will tell them, by answering a few questions, we can tell them the likelihood of them having PCOS. So at least they can be their own health advocate, and at least they can start from there.
That's brilliant. I didn't know you had a quiz, but I just sent the girls that work with me at the clinic, I sent them the OV website. Is that how you say it? OV. Yeah. I was like, put everybody on this. And then that quiz will be helpful. I'll let them know that that's there.
I have to say, Delara and Layla listen to this podcast.
Those
are my daughters. They keep buying stuff and they're like, my skin breaks out. This one's this. So please listen.
Yeah,
so it'll save you a lot of money.
You can check out your current ingredients, but also before you buy new ones, before you go buy, you have your cart of 10 products, go plug them into the checker. That way you're not buying it, and then a week later it's breaking you out aggressively, and then you just wasted all that money. So you can easily filter things out.
Totally.
So go ahead.
Yeah, so identifying the problem and getting rid of it, that's step one. Then you know what to replace. If you find out that it's your moisturizer that was breaking you out, which is extremely common, then you know to get our moisturizer. That alone can make a massive difference. Then we need to get the strategic exfoliation in there. Mandelic acid is kind of the hero when it comes to AHAs for acne. For basically unclogging the pore, you want to use an acid, right? There's salicylic, which is what you get at CVS. And then there's glycolic, which is a little more irritating, and it's a little bit better for anti-aging products. But then there's mandelic acid. It is stronger than salicylic, but it's not as irritating as the glycolic. It works on fungal acne. It physically unclogs the pore, and it kind of melts the clog away. That's what we need. So everybody needs the mandelic acid, which is Clarity. I'm a big fan of using a gentle scrub before you do that step so that you give it direct access to the pore. So our kit has the scrub, it has Clarity, and then, that's your exfoliation. And then you go on to the serum and moisturizer. And our serum that's in that kit is Cell Renew. It's the scar reversing serum. It's why Kayleigh doesn't have any scars.
Mm-hmm. So Danielle was formulating our Cell Renew serum when I met her when she just got me clear. So I was working on the scar damage at the same time she was getting me clear because I had the type of acne where you should have the deep pitted scars. Yeah. And so that product is truly why I don't have any scar damage left over because I've never done lasers for
you
scars. You
haven't for your scars?
No. Oh, Cell Renew. And then a few years later, I dabbled in, and I love microneedling now, but that was after my scars were clear. I just like doing microneedling for anti-aging.
Right.
Yeah.
Yeah. So Cell Renew has it's basically like an adaptogenic growth factor serum. So it has the willow herb, reishi, stem cells, and then we're actually reformulating it to put allantoin, which is that scar reversing ingredient. So that's the scar reversing serum. And then the moisturizer that has no pore cloggers, but it has the collagen stimulating skin foods that we want. So it has bakuchiol and plant stem cells and squalane in there. So for someone who's just starting out, first of all, get rid of the pore cloggers. Step 2, get the clear kit. That's like the cornerstone of your routine.
And how often do you use these? Every day, twice a day?
Pretty much, it just depends. If you're a little bit oilier and thicker skin, you can do the Clarity like every single night. Some people with drier skin, they might do it like every other night. Mm-hmm. It really just depends. So we make our products strong enough so that they can actually do the job. But then depending on your skin type and sensitivity, you adjust the frequency.
Well, and talk to me the differences in which products someone would buy if you're a teenager with acne or if you're, perimenopause with a little acne. Like what would they use the same products? Is it the same kit? Or is it totally different?
The kit would be the same, but then what you complete it with would be different depending on your goals. So if your focus is anti-aging, you would either do the Golden Hour oil or you would do our Bounce Back serum, which is our peptide serum. It's nicknamed the Botox in a bottle serum. But basically you would just complete your line with the items that are more targeted to what you're trying to do. If you're a teenager, I would do the kit and then I would get the sulfur spot treatment, the sulfur spot and like mask treatment. I don't think you would need that because it would just dry you out, right? Mm-hmm. So the kit applies to everyone, and then you supplement it with the products that correspond to your individual goals.
And then what about for all of our PCOS patients that are listening? What do you recommend for them?
The kit and then your supplements. And then also our Mind Body Skin supplement. They're very complementary. Our Mind Body Skin supplement is it's meant to be an alternative to Accutane. So it has some DIM, it has B5, it has digestive blend, liver and lymph support, vitamin A, turmeric, and a little bit of glutathione.
Amazing. What is it called again?
Mind Body Skin.
Amazing.
Mind Body Skin.
It doesn't have the inositol, which is so important for PCOS. So if you have PCOS, I would do your supplement and ours, and that would be like the best, most comprehensive strategy.
And how often do they take your supplement?
Every day.
Every day.
Yeah. Everyone's different though. Some people take 1 capsule every day. Some people are on the full 3. Some people just take 2. It really does help multiple body systems. You can slow down your dosage or you can do it like every other day. Like everyone kind of finds their own dosing strategy with it.
Amazing.
And what about boys versus girls? Do you see a difference in skin when you're dealing with boys with acne or girls with acne?
With boys, it can be really severe. Mm-hmm. It's generally tied to all the testosterone, but also guys are eating some of the same food triggers. Most of the time, whey protein. Every guy has a moment where he gets on whey protein to bulk up. Whey protein will break you out like there's no tomorrow. Eggs is another one that a lot of guys are eating a ton of. They're trying to get their protein in. Eggs can be a huge trigger. So for boys, I say whey, dairy, and eggs are the biggest triggers for sure. With women, it's more about products because we're generally using a lot more products. It's about hormones as well, but the product issue is a bigger issue for us because we have so many skincares and so many makeups.
And I think that's a good point. I think that, I remember going to the dermatologist and they said, bring me everything that you use. And I literally brought like this bowl of products.
You're like wheeling in a suitcase.
Yeah, and they were like, the problem is you need to pick 4 out of this 100 because you're like, here, let me do this and this. And then your skin starts going, oh my God, oh my God, oh my God. It's just something, it's too much. And I think that's probably what happened to you with your PCOS.
She did have a carry-on. When she came in, she literally wheeled in a carry-on. She had so many products.
I had so much. I mean, God, I was taking so many supplements. I was getting sent so many products too. And I was just using everything. I had no idea what to use. I was switching my routine every other day.
And I always, I want to make sure for our listeners, for the moms with daughters with acne, always make sure you look for the underlying condition before starting your child on Accutane. You have to, like you said, you have to attack it from all different angles.
Otherwise, it comes right back. I literally did it 3 times. My acne came right back, and it was from stuff in my skincare.
Right.
Mm-hmm.
And what do you think about lasers? In our age group, we grew up on like the laser, like more is more is more. Like, let me laser. Let me do the CO2 laser that blew my face off.
Well, with your skin, not my skin. Speak for yourself.
Oh, yeah. You're right. We have very different skin.
I can't do laser.
You're right. So with my skin, do you recommend people that suffer from acne to do lasers, and which ones do you like?
Totally depends on the laser and the person and their skin. If you have any pigmentation concerns or melasma, you got to be really, really, really careful. I am actually, I'm about half Peruvian. My mom's side is actually really dark. You would never know it by looking at me, but I hyperpigment really, really bad. And lasers actually did a lot of damage to my skin, and I have hypopigmentation where the melanocytes are just completely gone and now the spots are white. So I stay away from anything with high heat. That said, there's different types of lasers. There's laser hair removal. There's the ones that are like for veins around the nose. Those are pretty harmless for most people. CO2, I would never do. I've just seen too many things go wrong. And anything that can melt fat in the face, I don't do. If it has the chance to age you faster and it's irreversible, it's a no for me.
And then can we just talk about clean? You know, that word gets used a lot. Clean beauty, clean ingredients. And how do you guys determine what's clean for your company?
I think that's a great point, because clean does not mean Acne-Safe. And I think a lot of people turn to clean products thinking it's going to help with their acne. But there's so many clean pore cloggers that exist, like some Danielle mentioned already: coconut oil, shea butter, certain algae derivatives, because algae oil can be really thick, a lot of oils. And so a lot of people just turn to clean beauty to solve their acne, when in reality it can actually make the acne so much worse. And I do also think clean can get thrown around a lot as a greenwashing term too. Okay. Clean means different to everyone. Everyone has different clean lists. And so we really like to focus on functional ingredients that are going to help your skin. We also are really diligent on what fillers we use. And that's where, because the active ingredients are great, and the filler agents, again, are where the problems exist, where there might be, quote, non-clean fillers, the pore-clogging ingredient fillers, all of those. And so we are super diligent. We do all safety testing on our ingredients. We focus on no endocrine disruptor ingredients. And so I'm so proud of all of our formulas, because we have the science with it, and we have what we've determined as our own clean list that we feel very good about, that Danielle and I feel really good about, because we're both very concerned. I mean, we're using all the clean and non-toxic cleaning products in our house. Right. Like we are the consumers of it. And so our ingredients truly have to match what we would be wanting to put on our body every single day.
And what about your clinical trials?
Clinical trials went really, really well.
What were you looking for, and what did you do to try
We wanted to see if people, so we had them do just the skincare and then the skincare with the supplements. So people with just the skincare saw a ton of improvement, but people with the skincare and the supplement saw something like 82% improvement, and they didn't get any other guidance from us at all. So they could have been still using a pore-clogging makeup. They could have still been eating all the dietary triggers. So basically it was like, great. We knew that it worked overwhelmingly well for the majority of people. And then once we supplement that with the education that we give everyone, that's why all of our products have like a 9 out of 10 review. Like we got to that 90% success rate plus because of the education that we supplement with.
What I'm most proud of with how we've built a brand on education and a root cause approach. Because for the first 2.5 years, we only had one product. It was our Cell Renew Serum. And so we had to really use education to transform people's acne. So we just educated them about every other root cause of acne that people could look at in their lifestyle, diet, supplementing, to truly, truly help them. And then for the next 2 years, so like 4 years, we only had 4 or 5 products total. And again, we supplemented this by educating our consumers, because we knew someone's just using our Cell Renew Serum, we can only make a certain amount of difference with them. And the way we can truly help clear people's skin at scale when they can't come into San Diego Acne Clinic is getting on Instagram Lives, hosting master classes, using all social channels, getting on podcasts to help people identify all of these root causes. And then, of course, our products help so much topically in our mind, body, skin. Once we finally finished formulating that and running all the clinical trials, the difference that can make internally for people's bodies are incredible. But we truly built a brand just helping people get to the root cause of their acne and bringing awareness to it and getting people to think differently when it comes to acne.
Can you talk about how important it is to clean up your makeup before you go to bed? You'd be surprised how many people don't wash their face.
Do you recommend washing your face morning and night?
Okay, so great question. In the morning, most people can get away with just splashing their face with cool water. That is ideal because it preserves your moisture barrier and it helps you it basically helps you maintain your moisture in your skin, which helps you avoid getting UV damage faster. Mm-hmm. But it depends on what you put on the night before. So if you're using a moisturizer that is super thick and has pore-clogging ingredients, and you kind of sweat in the middle of the night, which most of us kind of do, then you for sure want to wash that off in the morning. Once we get rid of pore cloggers, all the problems get so much easier. So say you're on Clearstem and you're just using our moisturizing, like any of our moisturizing products. Like say you just use the oil before bed and followed it with the lotion. You can wake up in the morning and just splash off and you're good to go. You don't have to cleanse it off because there wasn't anything pore clogging to begin with. And a good splash is kind of all you need. So that is what's best for anti-aging as well. If you have active acne, really oily skin, and you like a lot of pustules, say like a teenage boy, for them, it is better to cleanse in the morning with a medicated cleanser. That way they get like the efficacious first step. So it's just different depending on what you're trying to do, but most people are better off doing a very light cleanser splash in the morning.
And what about makeup wipes?
We're not a fan. We're not a fan at all. They're also bad for the environment and they leave chemical residue everywhere. So the best thing to do is make sure you just have a really good cleanser. If your cleanser isn't good enough to get off your makeup, get a better cleanser.
Right.
Ours is designed specifically to get makeup off very quickly and easily, especially eye makeup, because you don't want to be tugging at your eyes. That's the number one thing that ages people faster, is having a medium cleanser that isn't that great and doesn't get their makeup off. So they're like tugging to get their eyeliner and mascara off. Our cleanser actually gets it all off very quickly and then you're good to go. You don't need another step.
For, I don't know, 25 years, 30 years now, I use Retin-A at night and I do vitamin C in the morning. So I was told that when you apply vitamin C for 20 minutes, you don't apply anything else on your skin. But what about Retin-A at night? Can you do moisturizer? Because I do my eye cream, my Retin-A, and then I go to sleep. So I don't really use a moisturizer. How important is a moisturizer for someone my age? I'm 54.
I think you're beautiful, by the way. I think moisturizer is really important for everyone, especially if you're using a retinol, especially a stronger one like Retin-A, because it does make your skin a little bit more vulnerable and you want to stack your barrier at night. So I think everyone should look like a glazed donut at night as many nights a week as you can. And with the vitamin C, that's absolutely correct. You want to let it sit alone as long as you can. 20 minutes is great if you have that amount of time. But letting that sit alone is great. At night, you definitely want to let other things sit alone as well. Like if you're using an AHA or any sort of acid product, let that sit alone too. Because with an acid product, the moment you put something else on, it kind of neutralizes it. So if you're using, whether it's glycolic or mandelic or any sort of like exfoliating serum, let that sit alone as well.
Before Retin-A?
I would alternate nights. I wouldn't use a Retin-A and an acid on the same night.
Got it.
Yeah, that's
and
a little
what
too
about
much.
rosacea? What do you see with people with rosacea? What do you do?
Calming ingredients. Our products actually work really, really well for rosacea skin. And it actually is helpful to exfoliate. And mandelic is the best one for them because it helps build the collagen. It can get rid of that surface bacteria that could be irritating it. Rosacea is highly linked to internal triggers too. Internal inflammation, alcohol, gluten's a big one for rosacea. Look inward for rosacea for sure.
For perimenopausal and menopausal women, what should their routine be?
Well, the kit is still like the great starting point for everyone because it gives you the exfoliation that you need. Regardless of what type of acne you have, you still want a physical and chemical exfoliant.
And you do that morning and night, both
Mainly just at night.
Okay.
Yeah. In the morning, think of it as just like hydrating and protecting. At night is when we do the corrective work.
Okay.
Like, for example, you shouldn't do Retin-A in the morning. You should do that at night. Yeah. So you do the bulk of your corrective work at night so that you don't immediately go in the sun.
Okay.
So yeah, if you're perimenopausal, I would do the kit, but then I would just do bounce back serum for anti-aging. And then I would do the golden hour because perimenopausal and menopausal skin can be a little bit drier.
So I can put this on top of the Retin-A.
Yes, I was going to tell you that's when you should work it into your routine.
Okay.
Do you guys have a Retin-A product?
We don't. We're not huge fans of retinol. We prefer bakuchiol.
Okay. Do you have a bakuchiol product?
It's in our moisturizer.
Oh, okay, great.
And you know what? Even though we're not a big fan of Retin-A, we just feel like it's a little harsh for a lot of people. And it's my personal ethos that anything that makes you more sun sensitive, it's probably going to backfire on you. So I love being out in the sun. That's why it's not for me. But whatever you're doing is clearly working for you.
I'm never in the sun. I'm in my office, honey.
There we go.
6 a.m. to 6 p.m.
Yeah, you might find that if you move to Florida and you're
problematic.
out all the time, the Retin-A might not be the best thing for you. Or you scale it back to 1 to 2 nights a week. You know what I mean? So like the gas pedal and knowing when to pump the brakes.
I can't use Retin-A.
I can't
it
either.
makes me flake off.
Yeah.
Like,
Well, everyone flakes off when you first start. I flaked off too, but now I don't flake anymore because your body your skin gets used to it.
It can. One thing about Retin-A though, the white cream version actually has that pore clogging filler agent called isopropyl myristate. So that's why a lot of people report a massive purge and surge in acne when they start that one. And for some people, it doesn't go away. So if you're truly acne prone and you've decided you want to do the Retin-A route, get the gel version. The gel does not have the isopropyl myristate.
I'm coming to you.
Yeah. We are both. So we're going to have links to the right product for people that want to really follow the protocol that you guys have talked to.
We'll probably put Bright Eyes in there too. Bright Eyes is
my favorite product.
Yeah, it's our peptide eye serum, but you can also put it on your lips too.
I need
and
that.
it's very specific
You're
peptides for the eye area. So
you guys are. This has been a masterclass.
I'm going to go shopping right now.
Yeah, we're so excited. We're going to do all of this. And by the way, we might just get in the car and come down there and see you one day. That would be fun for us to do.
That would be so fun.
Okay, so before we let y'all go, we could sit here for hours talking about skin. It's my favorite thing. Give me top tips for somebody suffering with acne.
Ooh, number 1, do not wash your face in hot water. It causes more damage and it creates a really aggressive environment so the scars cannot heal. So not only does it further inflame the acne, but then you're causing damage. So then you're more rapidly developing scars and the scars can't heal at the same time. So do not wash your face in hot water.
That's a good anti-aging tip too.
Yeah.
Hot water destroys your barrier. It makes you age faster. It makes all the problems happen. Yeah.
We're
not on the moneymaker.
Sorry, we're not.
Number 2, pore clogging ingredients. If you become obsessed about anything, make it about pore clogging ingredients. That is the top.
And on your website, you have those ingredients.
Yes. We have a full-on checker where you just copy and paste it.
Amazing. And foods that you should avoid.
Top foods, eggs is a really big one. And again, you don't have to necessarily remove these foods forever, but this should be a part of your elimination diet with your acne. So eggs, dairy, gluten's really high up there. It does affect everyone a little differently. It could be joint pain, sinus issues, psoriasis, eczema, but for a lot of people it can cause acne. So I would say removing eggs, dairy, and gluten is your top 3.
Okay, and then your favorite products.
Okay, Bright Eyes for sure. And then
I need it.
I'm obsessed with Bright Eyes. It feels so good. And then the moisturizer. Actually, no. Okay. I get 3.
Okay.
Topical and internal and
her
external.
children.
Mind, Body, Skin saved my life and my skin. Acne is very devastating and nothing worked for me. Mind, Body, Skin, that formula, I still take it to this day. I've been on it for 4 years. My levels are the healthiest they've ever been. My skin is in control and I can live my life. So that would be my all-time favorite product for what it can do for your life.
Amazing.
What about you?
My favorite product, oh my gosh. Okay, our skin spray. I think I have a few drops left in my purse. We have to get you guys skin spray. I go through it so quickly at this point. It's an amazing hypochlorous acid spray with peptides, magnesium. So it's anti-inflammatory, antifungal. I meant antibacterial. Really hydrating and calming for the skin. I spray it on my face literally all day, every day. It also has some ingredients that help protect against blue light because aggressive amounts of blue light can cause aging in the skin. So it's great. Like if you're in front of a screen all day, it's so great to have on your skin. Every single makeup artist that we've worked with too, it's their new favorite product because typically they'll have to have their client wash off their face and then they'll reapply skincare because they need a really amazing base for, if it's red carpet makeup, TV makeup, whatever it is. And recently they've just been using skin spray to prep the skin because it holds the makeup so well. So I literally can't live without that product.
So where can everybody find you?
You can find us on Instagram, Clearstem Skincare, all social channels. We do so much education. Also on our website, take our skin quiz. It'll actually give you an acne checklist that is all in reference to root causes. So it'll walk you through a lot of the steps that we talked about today in written form, which can be really helpful. And we educate about all the root causes of acne on our social channels. And then on our personal Instagrams, we not only educate a lot about skin and acne, but also the lifestyle as it relates to skincare. And so Danielle is Danielle, the acne guru, and mine is Kayleigh Christina.
Oh, you guys, thank you so much. This was a true masterclass in skin and acne and aging, and I can't wait to try all your products.
Thank you. It's so good to be with you.
Thank you for educating us. Thank you so much.
Thanks so much for joining us today on SHEMD.
If you want to own your own health, a good place to start is by following us on social media at SHEMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SHEMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SHEMD, some of the products and services we discuss may involve sponsorships or paid advertising.